Good morning and welcome to COVID-19 Talk with local health authorities. We have a new guest public health authority representing Harris County, and that is Saad Zahir representing Harris County. We have Dr. David Purse representing the city of Houston. Special thanks to past President Kathy Finninger of Rotary Club of Houston and Morgan Ash, our producer. I'm Stephen Williams, the director of the Houston Health Department. A lot has changed in the last week or two. And so we have questions that are very relevant to that. The first question is relative to vaccines. Have you heard how successful it's been offering money to get employees to be vaccinated?
So I don't know about employees specifically, but generally in our efforts, we've been offering money. It's been in the form of gift cards, $25 gift cards, and it has not been nearly as successful as we would have hoped. We did do a survey of folks to ask them, what would it take for you to get vaccinated? And there were a variety of answers, but when it came to financial incentives, people seem to say they wouldn't get vaccinated unless it was over $100. So we probably can't afford that. But specific to employees, I don't know, but overall, it's been disappointing. I would say that.
Yes, I know we just started to give a $25 incentive. And as we were doing that, CDC actually changed the cap from $25 to $100. So we'll see whether or not we can afford it. Second question, I've read that Novavax has less side effects than other vaccines, though it isn't often mentioned. When will it be approved for U.S. use? Is there pressure from pharmaceutical companies to prevent competition? Even though they are still free to the consumers here, it appears the price for vaccines is rising.
So Novavax published, its phase 3 U.S. trials, that results from its COVID vaccine in mid-June. So we noted, that the vaccine was over 90% effective.
There was talk about it's being approved. David, do you have an update on that?
So last I saw in early July, the FDA came out and said they expected to be issuing an EUA shortly, but I've not heard anything since then. So I don't know. I don't know what slowed it down.
A media doctor said if you have not been fully vaccinated and do not have natural immunity, you will ultimately get COVID. This sounds like a scare tactic and not based in science. What would you say? Did you say that, David?
I think I'm the media doctor that said that, and I said that yesterday at the mayor's press conference. And it's not intended to be a scare tactic. It's based on science. So when we look at the Delta variant, there's a value we talk about. It's the R naught. You'll see it in the paper, the capital R and then a little 0 next to it. What you see in a lot of the papers is a capital R with a little T next to it. And there's a difference between those. The R naught, the R with the 0, that is in a community, how easily does a virus spread throughout a community where people have no immunity? And that is a characteristic of the virus itself. And so to give you some perspective, the seasonal flu is about 1.1, 1.25. So that means it's spreading. For every one person who's infected, they're going to infect another one or a little bit more than one person for every one. That's why the flu spreads. If that number is less than 1, then the epidemic, it sort of collapses on itself. One of the most contagious viruses that we know of is the measles. It has a value of 10. The Delta variant has a value of 6. In other words, for every one person who's infected in a community of uninfected people, every one person who's infected is going to infect another 6 people. And so as we look at Houston, we see that our RT, which is how fast is it spreading in our community, is down to about 1.5, but that's because we've got about 60% of the people are vaccinated. And then there's another perhaps 15% that are immunized from previous infection. But for the remainder of folks who are unvaccinated and weren't infected before, with a virus with an R naught of 6, for every one person who's infected, they're going to infect on average 6 more people. It's going to spread like wildfire. And that's exactly what we're seeing. We're seeing the hospitalizations go skyrocket. The Texas Medical Center is adding over 100 new admissions per day over the last 3 weeks. So this is not a scare tactic. This is just what we've seen, epidemiology. We've seen this with other viruses, and this is what is going to happen. And people just need to know this. We're not trying to scare anyone, trying to educate folks so they can make the best decision for themselves.
Well, actually, they're making decisions not only for themselves, but for folks that are around them in the general community, because we are seeing our medical system, our healthcare system being taxed. I'm hearing more cases that the past 2 weeks among my vaccinated friend, and I'm worried. They're still very ill. They aren't very ill, but they got severe vaccine reactions to the vaccine, and I didn't. Can you shed some light on whether there is any connection between the vaccine reaction and what I assume is the Delta variant? I guess the question is whether or not, because that person didn't have a reaction to the vaccine, whether or not they're covered or not.
Yeah. So looks like we lost Dr. Zahir, so I'll answer this. So there is a correlation. It is not very close or very strict about, if you had a reaction to the vaccine. When you have the reaction to the vaccine, that is your immune system revving up and responding and reacting to the immunization. The stronger your reaction does not necessarily indicate how much immunity you will get from the immunization. So I wouldn't worry too much about that. But we are hearing about cases of folks who are previously vaccinated who are coming down with active COVID. Now, one thing about that, and this frustrates me, because while it's a lot more newsworthy than it should be, because we were just talking with Dr. Borwinkle from the School of Public Health this morning, who was showing us a graph, and when you look at the number of folks who were vaccinated who are becoming infected, you compare that to the unvaccinated on the graph. So there's a little bit of a bump. There definitely is a bump of people who are vaccinated who are becoming infected. But when you compare that to the folks who are unvaccinated, that's going up like this. But the media is paying a whole lot of attention to this little increase amongst the vaccinated. Remember, the vaccine was never portrayed to be 100% effective. If you take a person who's vaccinated and you put them in an environment where they're surrounded with people that are infected and shedding virus, at some point you're going to overwhelm that person's immune system and their ability to protect themselves. And so I'm curious as to exactly what's going on. But either way, don't pay attention to the little blip in the vaccinated folks. Pay attention to the unvaccinated and how those numbers are skyrocketing.
David, you're showing a whole lot of passion this morning, and I think it's directly related to what we're seeing in this community. Are the breakthrough cases showing any change in the efficacy rate of various vaccines?
So, the breakthrough cases, Stephen, is not showing the efficacy, decrease in any kind of vaccines. What we have seen, breakthrough cases is there are very far and few, over 99% of the vaccine or 99.5% are very effective. And that is the critical tool to bring pandemic under control. But we have to realize, not 100% of any vaccine is going to be effective in preventing illnesses in vaccinated people. Just an example, more than 163 million people in the United States have been fully vaccinated as of July 26th. Like any other vaccine, there are going to be breakthrough cases, but they are very few. We are seeing, the vaccines are working as expected. Asymptomatic infections among vaccinated people would occur. We also have to realize, that there are certain, circulating variants, and they would cause, some breakthrough vaccines. We are also seeing people who have immunosuppressant conditions. So the breakthrough would be there. But, if you look at cost-benefit analysis of people, who are having breakthrough cases, they are very few as compared to, the need for having vaccination of people, who are getting sick, hospitalized, and dying. Most of them, can be prevented by vaccination. So vaccination is the key. Breakthrough cases are very few, that are happening.
Absolutely. TMC shows almost 1,500 cases each day and over 150 hospitalizations per day. Please update us on the area.
Right. So when we look at SETRAC, and everybody here can look at this at setrac.org, setrac.org, shows hospitalizations across the 25 county area. And you can look at it by the trauma service areas, so that's about a third, or you can look at it by individual county. And it's looking at basically the same data that TMC reports, just from a different angle. And we're basically seeing the exact same thing. It's that the number of hospitalizations within Harris County, for example, that's the one that I look at every day, are going up very steeply. And so the TMC is adding 100, 150 patients per day. And we're seeing the same thing. So I see that so we're sharing, if you can go to COVID-related census, if you want to click on COVID-related census in that upper right corner, you can see how steeply. And right now, this is for all three service areas. Morgan, if you want, in the sort of the middle there where it says county, you can then select just down from there, county. Yeah, select for Harris County. And so you see it quickly, it adjusted. So yeah, you can see how steeply the hospitalizations of COVID patients, that upper part is for the ICU beds, the lower part is for general beds. And it's a dramatic day over day increase in new patients being hospitalized. And then actually, if you want, well, we got it. If you can go to the dates, you see the dates there up on the left? And what I always do is say, so with the first one, yeah, just change that from 2021 to 2020, and there you go. So this goes back to when they first started collecting. So that's the first wave there back in July of last year. And then the next wave that came in around January of this year. And so this is how you can put it in perspective and see this current rise is very steep. It looks a lot like that one we saw last July, a year ago. But what has me concerned is we reported yesterday that the wastewater data already is more than 3 times higher than it was in that July 2020. The most fires on the wastewater that July 20, we're already today 3 times higher than that. So not exactly sure. We're going to find out what that means, but it doesn't mean anything good.
An outbreak in a group in Cape Cod found that of the 469 cases, 74% were vaccinated. CDC said the variant is more contagious than chickenpox and is recommending everyone to wear masks in public indoor areas and high transmission areas. What can we learn from this?
So, I mean, like, first of all, that was a standalone study. I mean, like, that was done. No patient, I mean, like, that was admitted died. I mean, like, people who were admitted there were 7 cases, I mean, like, who were admitted, and none of them, I mean, like, showed any condition, I mean, like, that would be causing them to stay for long times. The implications are that even unvaccinated, vaccinated people who are symptomatic as well as asymptomatic can potentially transmit the virus to other people, which is main reason, I mean, like, for updated mask mandate right now. I mean, like, people should be wearing masks indoors, even if they're vaccinated, in public setting communities where we see high risk rates of transmission of virus. And we did see, I mean, like, high rate of transmission of virus in Cape Cod, I mean, like, during that public congregation and people, I mean, like, that were accumulated over there. We have to remember Delta variant is far much more transmissible than the previous variants of COVID-19. The highly transmissible rate of Delta variant proves that, I mean, like, we need to get vaccinated against COVID-19, as well as, I mean, like, as it can cause, I mean, like, if it's causing a high viral load, there is going to be increased risk of transmission. And like other variants where this variant, vaccinated people do have the tendency of transmitting the virus. This finding was kind of concerning to us as public health officials because it's a pivotal discovery that CDC has to update mask recommendations. Although vaccination is the most important to prevent, I mean, like, the spread of disease, we also have to realize masking up, multi-layering strategies, they need to be successful, and they are successful. So the lesson learned is, even if you are vaccinated, if you're going, I mean, like, to multi-congregations or settings, be careful, I mean, like, wear masks. That's an added layer of protection.
Austin Hospital's ICUs appear to be getting hit hard. With 2 of my children getting ready to be there for college, how worried should I be?
So your children are going to college, so they're college age, and what we're finding is that most people in that age group, when they're becoming infected, they're actually tolerating it pretty well. So I would, and hopefully they're vaccinated. So if they're vaccinated in particular, you can anticipate that should they become infected, that they will not become terribly ill. Now, the hospital situation in Austin, just like here in Houston, is dire, and it really is. We just looked at the graph, saw the hospitalizations that are going up. One thing to keep in mind is that back in last July, when we had that spike in July, that was a time when people were afraid to go to the hospital because they were afraid if they went there, they'd be exposed to COVID. So there were fewer hospitalizations of other issues at that time. And so the hospitals were able to absorb that increase in COVID patients. Today, people aren't as afraid because hospitals are much safer, quite honestly. And so now the hospitals are already packed full. And now with this increase of COVID patients on top of that is what's straining the healthcare system to a critical point. And I'm going to tell you, so this morning I was on a conference call, we were talking about moving patients around the area. And over the last couple of days, there are 3 patients that I'm aware of. One had to be transferred from the Houston region to a hospital in New Mexico. I've actually had a family member who had to go from a hospital in Livingston to Shreveport, Louisiana. And then with SETRAC, because I work with SETRAC, we coordinated transfer of a patient from a freestanding ER to a hospital in, don't fall out of your chairs, from a hospital here, or from a freestanding ER here to a hospital in North Dakota.
Wow.
We are now regularly looking out of state to find hospital beds. That's how bad it is.
I was in close contact near a fully vaccinated person that was told by their doctor to quarantine 7 to 10 days. Everything I've read says 3 to 5 days. Although I don't want to chance spreading anything, if I feel fine, can I go out with a mask on? Sounds like we're missing some information.
All right. Yeah. I mean, there's so many new CDC guidelines that are coming in. So the confusion is there. People who are fully vaccinated, they don't need to quarantine after contact with someone who had COVID-19 unless they are symptomatic or they have symptoms. The 3 to 5 days recommendations that have been given for fully vaccinated individual who had an exposure is to get tested. I mean, like 3 to 5 days after exposure. Anyone who had an exposure should wear mask in public for 14 days after exposure or until their test is negative. Unvaccinated people who had a close contact with an individual who has infection should quarantine regardless of the patient's or the person's vaccine status. So we are strongly encouraging everyone who's eligible to receive the vaccination, and that's the key. That's the public health messaging that is out there.
All models for COVID assume behavior isn't changing. What model should we be following?
The fact is that behaviors don't appear to be changing. And so the models, a lot of the models that we're working have been predicting pretty accurately what's going to happen. So if we want to, what model we should follow the model of, I'm trying to think of a community that's actually changing their behavior. We should number one, get vaccinated. Number two, wear your masks, even if you're vaccinated indoors, because you can still spread it if you're infected. And we need to go back to, I hate to say it, but we need to start considering social distancing and not going to crowded events. Nobody wants to lock down the society and cancel things. I get it, but you can't have it both ways. We either start acting responsibly or we're going to have more problems.
Warnings about hospitalization taxing hospitals. Didn't we prepare for another surge?
So we did quite a few times, but we have been through multiple COVID surges at this time. So what is contributing, what is specific for this surge is this is the highly transmissible Delta variant. We know this variant is far much more contagious than any other, circulating COVID strains that are out there. The variant, we had in March is now responsible for 80% of the infections that have been happening in the United States. Largely, it's happening with unvaccinated population. Although, we know that these vaccines provide protection against severe disease, hospitalization, and death. Fully vaccinated people, can transmit to Delta virus to other vulnerable individuals. Having said that, we have been preparing for surges, and hopefully, we'll be able to get through this one.
Hey, can I add something to that? Because I agree with everything you said. But so in our planning for surges, two things have changed. One is when we do most of our surge planning, we think of hurricanes. So when we have a hurricane come in, the rest of the nation can send us resources. So with the pandemic, the rest of the nation is in the same situation we are, so they don't have the resources to send us. And right now, on top of that, we're dealing with a man-made nursing shortage. And the nursing shortage actually comes from the previous waves we had when the federal government, well-intentioned, spent a lot of money so that we could hire nurses, traveling nurses. Well, what happened was nurses who had full-time jobs at Hospital A saw that they get paid twice as much if they joined up at the federal government, did a traveling nurse thing. So then they went off somewhere else, creating a vacancy in Hospital A. They got paid a ton of money, and now they're back because those contracts are all terminated. They're now back home. They're sitting on a pile of cash. They're exhausted, and they're not going to work. Now, that's not exclusive. A lot of them are going to work because they know the situation. But we do have a nursing shortage, and that has contributed to it some. And that was not, we didn't anticipate that in the planning. And
just to add, Dr. Pearce, I agree, with the nursing shortages, but we are seeing shortages, among public health staffing elsewhere, because, they have been through so much in the last 500 days plus, that it is definitely going to be a tough challenge to deal with any further surges. But we are prepared.
Yeah. And I don't want anybody to misunderstand what I said. I'm not throwing the nurses under the bus. The nurses are hardworking and dedicated. They got offered a lot of money. Of course they went for it. And now they come back. And you know what? The real thing of that message is the nurses who did that are back now. They're exhausted. The entire healthcare system is exhausted. And so, anyways, we got nursing shortages. We got physician shortages. We've had longstanding physician shortages. We got respiratory therapist shortages. I mean, we talk about the nursing shortage, but it's a healthcare provider shortage overall.
I think the whole health and public health system has been taxed for the last year and a half. And retention is really going to be a challenge. I've postponed surgery on my back for the past year. At first, my doctor didn't want me in the hospital because of underlying conditions. Now I'm 2 weeks away from the surgery and getting very concerned about being in the hospital for a few days. Can I insist anyone coming into my room be masked, or is that not something a patient can control? I guess it depends on the hospital he's going in, right?
Yeah, so I would anticipate, well, first of all, if it's an elective surgery, at this point, I got to warn you, I would anticipate that may get postponed again because the situation with the hospital is being overcrowded. They're postponing a lot of electives. So that's some bad news for you. In many hospitals, we know Methodist made national news, and now Memorial Hermann has come out insisting that all of their employees be vaccinated. And pretty much everybody in the hospital, whether vaccinated or not, are wearing masks. And in addition, they have really cut back on who can go visit in the hospital. So I think from your standpoint, from those things, if your procedure is still scheduled and moves forward, then I think that I don't know that you can insist on that. It depends on the hospital to see what it says, but even so, most hospitals are actually very safe places now. We're not seeing spread of COVID virus within hospitals. You don't need to worry about that.
Walmart and other companies are going back to staff wearing masks. Has research indicated that those vaccinated have been able to completely protect themselves if wearing a mask?
So, so far, the evidence is clear. There are multiple publications that have been done that masks strongly protect against COVID-19. It's not only COVID-19. If you name other droplet infections and aerosolized infections, they are being protected by wearing masks. Having said that, nothing is 100%. Combination of vaccination, other measures such as social distancing and hygiene practice, we can minimize the spread of disease. So the research definitely has indicated, that vaccines prevent and masks as an additional thing would be able to prevent that.
Isn't the medication used in hospitals under emergency use as well as the vaccine? If so, why would any person fearing the vaccine want to take those meds that are also emergency use?
Yeah, so even though it's an emergency use authorization, the scrutiny of these medications as well as the vaccines have gone through to get the emergency use authorization has been pretty robust. You got to remember that when the FDA authorizes something for full authorization, that is a multi-year process. And we don't have time for that. And right now, if I was sick and I was in the hospital and they were looking to give me monoclonal antibodies in order to keep me alive, I'll take them.
You like life, a person.
Yeah.
Can a vaccinated person who gets COVID develop a long haul case?
So, yeah, that's vaccinated person, are substantially reduced risk of developing illness, hospitalization, and death. And there are, cases that might be developing a long haul case. They haven't, researched that yet. But so far, even the breakthrough cases have been mild. So we are knowing the fact that, vaccines are reducing one risk of developing COVID-19. But it's still unclear. We don't have the data out there as to if vaccine impact a person's chance of developing long haul symptoms. There have been few studies, but we don't have, have enough data at this point that it would be causing a long haul symptoms. Having said that, there's so many unknowns to say what is causing, those long haul symptoms. So these current vaccines are great at reducing serious illness. They will not completely protect against all of the infections. The major takeaway, should be the benefits of vaccine is far outweighing the risk. And that's the most important things.
That is
These
the
COVID
bottom, that is the bottom line I think that we should go with on that one.
Right.
If an antibody test shows you're low, other than getting another vaccine, is there anything you can do to get your body to trigger more naturally without taking another shot?
Good question. There's not that I'm aware of. And remember that if you got vaccinated and you wound up with low antibodies, that that's probably there may be a reason for that, right? So we know that amongst the elderly, those on immunosuppressive medications, organ transplant, chemotherapy patients, et cetera, that they don't always generate the robust antibody response. I don't think that there's anything other than getting, and a booster has not yet been approved by the FDA, but these are exactly the sort of patients that is being considered for.
How accurate are antibody tests?
So there are different type of antibody testing, and not all the antibody testings are created equally. They are not 100% accurate. So these antibodies can take weeks, days to weeks, in the body following an exposure to COVID. And it's unknown, how long they're staying in the blood. So as far as a positive antibody test, it doesn't mean, you're necessarily immune from COVID. Infection. It's known, whether these antibodies will protect you from getting infected again. Also, even if a vaccinated person is negative for an antibody test, it does not necessarily mean that they have immunity to COVID-19. So they are not currently recommended to assess, immunity to COVID following in a vaccination or to assess the need for vaccination.
Will an antibody test tell you if you have ever had COVID as well as whether you still have protection from the vaccine? Or are there multiple tests to take?
Yeah, so if you were never vaccinated and you test positive for antibodies, then that would suggest that you were previously infected. But again, back to Dr. Zahir's comment, it depends on when the test is done as to what level you may get, which may or may not accurately predict what level of immunity you have.
Okay, that was actually our last question, and that's why I heard you along, Saeed. This has been your COVID-19 talk with local health authorities. We have with us from Harris County Public Health, Saad Zahir. We have Dr. David Pearce representing the city of Houston. Special thanks to past President Kathy Finninger, Rotary Club of Houston, and also Morgan Ash, our producer. I'm Stephen Williams, the director of the Houston Health Department.